Hello, everyone, and thank you for attending the Aunt Martha's Health and Wellness Virtual Job Fair event. I would like to introduce you to Karina. Karina will tell you about her company, job openings, and how to apply for those openings. Karina?
Hi, good afternoon, everyone. Thank you so much for taking the time to learn a little more about Aunt Martha's Health and Wellness. Hopefully, some of you have already heard of our organization before. But if not, that's okay too. That's what I'm here for, to go over a little bit about our organization and some of our opportunities here for employment and what the general process is to apply. All right, so we are a health and wellness non-for-profit organization, and we serve over 105,000 children and adults throughout over 600 communities in Illinois. We're also a licensed child welfare provider, and we also have our integrated care center, which we refer to as the ICC, that is located in Chicago and downtown. And it serves to stabilize the DCFS involved youth and prepare them for long-term placement. So this kind of gives you an idea of what our integrated services model looks like. As you can see, we are kind of encompassing three main areas there. We have our child welfare system, we have our community wellness system, and we have our health system. FQHC would be federally qualified health centers, which we are considered. So we do have clinics throughout the state of Illinois, and we'll go over a little more of where we're located later in the presentation. But basically, we are all over throughout the state of Illinois. And we have our primary care, dental, behavioral health, OBGYN, family planning, and substance abuse under the health division. Then we have our child welfare system, which would include the ICC, our HealthWorks division, foster care, and intact family services. And we also have our community wellness system. So we have under that crisis services, prevention, housing, employment, juvenile justice, and community partners. So I thought I'd show you a little video that we have up on our website. Kind of gives you an idea of what we're about here.
We were that family. Me and my mom together were women who were taking care of aging parents and raising children at the same time. She ended up with a tooth abscess with no insurance. And the only people who took care of her were our moms. There's a reason why the name is Aunt Martha, because when you have someplace to go, when you need someplace to go, when you're hurting, or when you're sick, or where there's no place else to go, you go somewhere that feels like family. That's Aunt Martha's house. You have to find some place to go that's safe and respects the dignity of every single person that walks in. That's what Aunt Martha's is. It fills in the gaps. It stands in the gap. And it's always there when we need them.
Great, thank you, Danielle. So that's a nice little summary of what we're about here at Aunt Martha's. And we do have quite a bit of other videos on our website that I would encourage you to take a look at when you can to learn a little more about Aunt Martha's. So here we have a timeline of our history. As you could see, we started out in the 1970s. We opened up our first drop-in center in 1972. Our roots are basically in the youth services area. So you could see there our first foster homes were established. So that's where our roots were. And you could see throughout time in the 80s, we started expanding into other areas with our community-based youth services. We had a Head Start at that time. In the 90s, we continued to grow. That's when we opened up our first shelter. We had group home expansion and so forth. In the 2000s, continued to grow. That's when we opened up our Children's Reception Center, which is now the ICC. And then now in the other end of the 2000s, 2010s, we started growing more into the health arena. We started opening up our clinics. As I mentioned, we have clinics throughout the state of Illinois. Our main corporate office is located in Olympia Field, so you may see a lot of that when you research Aunt Martha's, but please just keep in mind we have employment opportunities throughout our several locations in the state. So our mission, vision, and values. Our mission here is to, driven by innovation, integration, and care coordination, Aunt Martha's is committed to providing an exceptional, unique, and comprehensive patient experience. Our vision is a world in which loneliness, sickness, and despair are replaced with wholeness, healing, and hope. So our core values, we have excellence, diversity, collaboration, commitment and passion, and innovation. So, you know, when you do your research on Aunt Martha's, I encourage you to read a little more into that about what our values are that are very important to our organization. So I mentioned that we are throughout the state of Illinois, with Olympia Fields being our corporate office area. But as you can see here, our list is pretty extensive. We even have locations in downstate Illinois, in Danville, Illinois. Some of these locations are clinics. Some of these locations are administrative offices, and other locations contain dental centers or social services offices. So with career opportunities, we have, I would say, over 70 opportunities available, currently open right now. This is just kind of a general list of what we're currently looking for. We have therapists, a need for therapists, obviously very important role, much needed, especially during these times. And the cool thing about the therapist position, we did go to a remote opportunity there, so you can work virtually with the therapist positions. You do have to be licensed in social work or professional counseling. Medical assistants, they are a very big, important part of our organization here. They help our physicians directly. So we do have quite a bit of openings throughout our health clinics in Illinois, and they are pretty much openings throughout all of our health centers. Let's see, we also have the youth support specialists. These are the individuals who work out of our ICC that I mentioned earlier in Chicago. This would be a great opportunity if you are looking to, you know, help the life of a young adult. these are displaced youth who are in need of just to get things together so they're able to function on their own. So it is a residential area, and you know, if you have a social work background, that type of thing, that would be a great opportunity for you. So I encourage you to take a look at that. Crisis clinicians, we have program assistants and care coordinators. So as you can see, we have a little bit of every facet here that you can think of, social services, healthcare, and so forth. So if you do take a look at our website, you can see the full job description of each of these opportunities. So you could take a look and see if it's something that you are interested in, that you would qualify for, and please, you know, apply to something that you are interested in as soon as possible. And then you can reach out to me directly as well and let me know that you've applied. So we'll go through that process in a little bit. Our website is antmarthas.org. As I mentioned, all of our job opportunities are on our career site. We do have about 70 openings currently throughout our system here. Please take a look at the full job description on anything that you are interested in. Because we are affiliated with DCFS, a lot of these opportunities are have very strict guidelines as far as your qualifications. So it is important to take a look at that to see if that would be something that you would qualify for. And again, you could also send your resume to me directly. kmoreno@marthas.org is my email. You can reach out to me with any questions as well. So a little about how the process works for pre-employment here. The online applications and resumes are reviewed. If you are being considered, the hiring manager would reach out to you. The hiring manager are the individuals who actually look at the applications and will contact you if they are interested in speaking further to you. You would then receive a phone screen, possibly an in-person interview. I know a lot of interviews right now are also through Zoom. But it is possible you are asked to come into the office, of course, with precautions taken with mask requirements and so forth. Complete your application packet for pre-screening. We do have the whole pre-screening process here, especially in the areas where you would be working with our youth population. There is an extensive pre-screening process there. Once everything is done and you're good to go, then we would receive that information from the hiring manager, and we would contact you here in HR to extend you an official job offer. So we have, of course, all of our social media outlets here. Please follow us on Facebook, YouTube, LinkedIn. Like I said, our website has a lot of information. YouTube has more of those videos that you can look into to see, you know, our team in action and see what we do here as a team to pretty much we are serving the underserved population here in the state of Illinois. So thank you for your time. And I believe this is when, if you have any questions that I could possibly answer for you.
Fantastic. Thank you for your presentation, Karina. And as Karina just stated, if you do have any questions regarding employment with Aunt Martha's, please feel free to enter those into the chat and we'll get those questions answered for you ASAP. Karina, we did receive a question in the chat. This individual asked what your contact information is. I know that it was up on screen here. And so what I may go ahead and do is navigate back to those slides and keep those up so that folks have your contact info. Again, I just want to reiterate, if you do have any questions, please feel free to enter those in the chat. You have a prime opportunity, obviously, right now to speak directly to an employer rep. So if you do have questions, don't be shy. Please ask them now. We did receive a question already, so thank you for that. Question, Karina, is do you offer part-time opportunities?
We do. They're not, it is rare that we do offer part-time. Most of our employment opportunities are full-time. But again, you would see on our website which positions are on a part-time basis.
Awesome. Thank you, Karina. Next question that I have for you is how long does your hiring process typically take from the point of submitting an application to the point of actually being extended an official offer for hire?
Well, you know, again, the hiring manager is the person who would access your application if you submit it online on our website, which we do encourage you to do. If you are considered, you should get a call, you know, fairly soon. We aim to do that within, you know, a week or two of your application, if you are considered. And like I said, that's when the interview process starts with a phone screen, etc.
Awesome. Thank you, Karina. We did receive an additional question. That question is there a base salary or a salary based on experience?
It's, you know, it depends on the job, on the opportunity. We do have different levels of positions here. So if you're talking more of your entry-level job, say medical assistant position, that would be a base salary, and that would be determined based on if you are certified or not. So, for instance, if you are not certified, you would the base pay right now would be $14. If you are certified, then it would be about $1 more. So it really depends on the position you're looking for. But I would say for the most part, for your entry level type positions, it would be a base salary.
Awesome. Thank you for that, Karina. I do have an additional question for you. So for the positions that you covered here today, are there any sort of minimum education requirements that folks would need to meet in order to apply for any of those?
Yeah, so again, every job is different, and we do have qualifications listed under the job description for every position. So again, any job that is DCFS affiliated, you know, the education requirements will be listed on the job description. So you would have to have that background in order to be considered.
Excellent. Thank you for that, Karina. And then another question that I know is in the forefront of a lot of folks' minds right now is obviously, you know, pandemic related, COVID related. Are there any sort of safety precautions that your organization is following as a result of that? Do you guys provide PPE? I believe you stated, at least at the beginning of the application process, folks might be able to reach out to you via phone screen. What are some of the options that you offer for folks, you know, regarding COVID?
Yeah, so During the interview process, I had mentioned earlier, I know a lot of our hiring managers are going towards Zoom interviews, but there are there are instances that you would need to come into our offices to do, say, for instance, our pre-screening process. So, yes, masks are definitely encouraged, or it is mandatory to have a mask on. As far as once you are here as an employee, yes, definitely PPE is provided. We were one of the first organizations to roll out PPE for our employees in the sector that we're in. So we take that very seriously here. We take every precaution necessary. Most of our administrative type jobs are working for the most part remotely to be able to limit the amount of people that are in an office at the same time. So yes, we are definitely encouraging all safety guidelines here.
Excellent. Thank you, Karina. Another question that I do have for you is, how can a candidate stand out and get an interview assuming they are qualified for the position in which they are applying? Is there anything that you would suggest folks might highlight on their resume, or anything, advantageous that might help folks in that regard?
Mm-hmm. Well, I would say to start off with the simple things, and make sure your resume is up to date, that it's accurate, that it most importantly has the correct contact information on there. You would be surprised a lot of times we cannot get a hold of someone that we are interested in because their contact information is incorrect for whatever reason. And as far as standing out, I make sure you indicate on your resume any experience you have that is related to the position that you're applying for. It doesn't even necessarily need to be employment. It could be volunteer opportunities, anything to that nature that would show that you do have that experience within that area. Make sure you indicate that on your resume as well.
Great. Thank you for that, Karina. Another question that I have for you, I know that you are a kind of, health and social service or social assistance type of employer or agency. Obviously, I'm assuming a part of the hiring process would be that folks would have to undergo some sort of background check. The question that I have for you is one that I receive frequently, and that is, would misdemeanor offenses or minor infractions be, limiting factors for folks who might be interested in employment with Aunt Martha's?
Mm-hmm. Good question. Yes, we do. A background check is conducted. There's actually a couple of them that we need to do depending on, again, the position that you are applying to. But as far as the one general background check we do for all employees, and we do go over that during the offer process, that any offers that are extended are contingent that you clear all background checks. So misdemeanors can be something that may come up on a background check that may affect your continuation of employment. That is very possible, yes. So there is a process to that, and we do go over that during the offer process to the prospective employee. For instance, also if you are applying for a job we have a lot of positions that would require you to transport patients or clients. So if you have a bad driving record, that may definitely affect your moving forward with us, with that position anyway.
Thank you for that information, Karina. Another question that I have for you is, can you kind of elaborate a little bit more on what your shifts are? And if you do operate multiple shifts for your organization, are there any particular ones that you are applying for more than others?
Yeah, so, I know I've mentioned this a lot, but it's really kind of the truth with this. It depends on the position. We have so many different types of areas, as we went through earlier in the presentation, that it really depends on the job. So for instance, if you're working at our ICC, which is our integrated health care center in Chicago, the residential area, that is a 24/7 facility. So you're looking at 3 different shifts there. But if you are applying for a medical assistant position, that is, like a 8:30 to 5 p.m. job. Those are the clinic hours. So that's just the one shift. So it really depends on what area you're looking at.
Great. Thank you, Karina. And I just do want to pause here for one moment.
Mm-hmm.
I do want to reiterate that if you do have any questions for Karina regarding Aunt Martha's, please feel free to enter those into the chat. We'll get those answered for you. Karina, I do have one final question for you before we kind of begin our wrap up of today's session. That question is, what are the opportunities for advancement within your organization? And are there any particular success stories that you'd like to highlight for folks who might be considering employment with your organization?
Yeah, there's definitely opportunities for advancement here. We've had employees here working for us for over 20 years, that came, straight from college or high school and worked their way up. So there's definitely advancement opportunities here. You would be able to see all of our job opportunities just like anyone else on our website. If there's something that you are considering to say, just to maybe transfer to a different area, you can express your interest in doing that with your manager. Usually that's acceptable to be considered for if you've been here or you've been in your role for at least a year, so yeah, there's definite opportunities here. We encourage that. We want people to be able to grow.
Awesome. Thank you for that, Karina. And Karina, as we do kind of continue our wrap up here of today's session, I do want to offer you one final opportunity to give any sort of summary statements or concluding remarks that you'd like to make, anything perhaps that you'd like to highlight or let folks know before we wrap up here today.
Yeah, well, thank you again for taking the time to learn more about us. Hopefully I was able to shed some light on what we're about. Like I said, if you go on our website and see all of our videos, you'll be able to see quite a bit there. The governor recently actually did a press conference from one of our clinics where he praised Aunt Martha's, our whole team, and what we've done to roll out the COVID vaccine. So I encourage you to take a look at that as well. Again, please take a look to see all of our, I think there would be something for anyone that's interested in working with us. Just so many opportunities. So please take a look, reach out to me if you have any questions, and I can definitely help move things along.
Fantastic. Thank you for that, Karina. And I just do want to make note that this session has been recorded. I will be uploading it to the Illinois WorkNet YouTube channel later this afternoon. And consequently, it will be linked to the Aunt Martha's employer booth on Illinois WorkNet. So from those two locations, you can access this video, if not today, tomorrow. If you want to review anything that was covered here today while you are filling out your applications, again, as Karina stated, she has provided her contact information for you. So if you do have any questions regarding the application or just any general inquiries that you might have about Aunt Martha's in general, please feel free to reach out to Karina, and I am sure that she'll get those questions answered for you. Again, thank you for presenting today, Karina. I want to thank all the job seekers who are on the line as well. We hope that you have a wonderful day and a wonderful upcoming weekend. Thank you all.
Thank you. Thank you so much. Have a good day, everyone.